The reason I got involved in massage therapy is because I actually had a problem with my low back and my hips, and I went to see a massage therapist, and it helped tremendously. And I have always been involved in health and alternatives, and I love what I do. I have had so many benefits, seen so many benefits from the work that I have done with clients, and I love to see people feel better. Therapeutic massage is more than just your relaxing massage. It's about getting your body to function properly again. Your spine consists of a lot of different vertebrae. If your spine is misaligned, yeah, you can see someone to a chiropractor to readjust your spine and get it back into position, but why do those vertebrae come out of alignment? There's a lot of muscles attached there. When the muscles are contracted, they can pull on your bones. They can take them out of alignment. They can put strain, undue strain on the joints, on your vertebra, your neck. It goes all the way down to your spine, your knees. A lot of athletes who come in to see me have problems with their hips or their knees. Well, there's a lot of muscles attached to both. Taking those muscles out of their tight contracted state and just releasing them will take the strain off of the joints. That's what I do. That's the difference between the more relaxing massage and the type of medical sports therapeutic massage.
You definitely get more flexibility with the deep tissue massage. You are stretched in ways that you normally don't do unless you are into really yoga or stretching yourself. I mean, it's an awesome thing.
You know, everybody knows massage to be relaxing, help to reduce stress and anxiety and increase sleep and overall feelings of well-being, and there's a lot to be said for that. However, there are a lot of people who do not realize that it goes beyond that. It includes the muscles and the skeleton. Muscles are attached to the bones. They bring the bones closer or further apart. And when muscles are contracted, whether you're exercising or stressed or just driving, muscles become very, very tight. And you won't feel that they're very tight here, but you'll feel aches in your back, you feel strained, your neck. I want to bring those muscles out of that tight contracted state and relax them, but it's not just one muscle. You'll feel it. People will say, well, I'm feeling it in my back, and here I am working on the chest. Whatever muscles are attached to the shoulder or the shoulder blade or the neck, those are the muscles that I'm going to get to. We need to get those muscles to remember what they're supposed to be doing. They need to be relaxed and take the strain off of your joints.
The pain that I experienced from about 32 weeks on was so completely unbearable. I mean, I literally could not put one foot in front of the other without it bringing me to my knees. At that point, the baby was pressing down, maybe on the sacrum, on the nerves there. Immediately after the first massage, I experienced a loosening of the ligaments and was able to walk better.
There's a little bit more pressure involved in getting contracted, tight muscles to release, but the end result is everyone walks out feeling phenomenal. Everyone feels they've got so much better range of motion. Someone who had tight tension in their mid-back or in their neck or couldn't move this way or that way or bring their head down. The type of massage that I do will bring those muscles back into flexion and have more flexibility. Their range of motion is greater. You'll see the Olympiads. They always have their massage therapists. There are great demands put on their bodies, on their muscles they depend on. So massage therapists go in and do the types of massage that we're talking about and help to keep them more flexible.
I was so tied up in knots I could barely move my neck, I could barely move at all. I hurt from head to toe. She has very strong hands, and she uses them to get deep into your muscles to really help relieve at the source some of these tension areas.
There are also times when people have had medical procedures done, surgical procedures on a knee or a shoulder or what have you. Everything in that case will tighten up as well. A lot of doctors recommend physical therapy, and they are, you know what physical therapy is, they're putting the muscles and the joints into a better range of motion, more mobility for the joints. Massage therapy does the same thing. For example, I have one client who totally ripped his pec major muscle. It's the muscle that comes from the chest here and attaches to the arm, the humerus bone here. While he was exercising, he totally tore the muscle from its insertion.
Yeah, I was working out in this gym, and I was doing some bench presses, and I put a little too much weight on, and I completely tore my left shoulder out. And as a result, I had to have surgery. After about 3 weeks, I was able to come back in the gym and start recovery. And I was walking around the gym looking like a sad sack, and Lisa said, "I can help you." And at first I was kind of skeptical, but I was feeling pretty bad, and so I gave Lisa a chance, and it turned out to be one of the best things I've done this year. Immediately you could feel relief in your body in different areas.
He came to me. It was a little uncomfortable. I worked not only the muscle that he had the surgery with, but everything attached to the shoulder. After 2.5 months of working with him, the doctor dismissed him, said, "You don't need me anymore, just keep doing what you're doing."
Well, with Lisa, when I have mainly gone to her is when I had, I'm a pretty avid runner, so muscle imbalance issues will come up. I've had some hip pain due to hip tightness, some knee issues. She does quite deep work, very specific work, but when you get done, your issue is better.
Another part of my practice is CRT, Cranial Release Technique. It doesn't take very long to perform, but it unlocks your body's ability to heal itself. Even though CRT is a very quick procedure, you walk out feeling as though you've had a full hour massage.
The first time I had CRT, I was really tight, and I could feel it. I mean, when she was doing the technique, it was very restricted. I could feel the tension, but by the second day, I could start feeling some of that disappear. People should get a good, deep neuromuscular massage, I think, especially if they're in situations where they are in a repetitive pattern all the time. If you sit over a desk all day, if you drive all day, your body starts to develop asymmetrical patterns, you know, in your muscles, and eventually it'll start pulling on your bones, your spine. Other joints will start deteriorating. Lisa puts you at ease. That's part of the massage too. You've got to be able to relax. Otherwise it's going to be hard for her to get into those muscles and get benefit from the technique as well.
In today's environment, we are constantly on the go with our computers, our cell phones, television, everybody's schedules, women working more and handling more. We are in a chronic state of stress and we don't realize it. Our bodies were not designed for that much sustained stress. What cranial release does is it takes you out of that stress and brings you back into health and wellness. To get started, all you have to do is either call the office directly or through your doctor. If you've got a medical procedure, you can actually have your doctor write a prescription. It would be covered through insurance. If you've never been for a massage before, I have a very comfortable practice. You're fully draped and it's very private. I focus my practice on medical, sports-oriented massage, retraining those difficult areas, retraining those muscles back into balance. For you athletes, I help to increase performance, endurance, and strength. So come see me. I look forward to working with you.